Hi, it's Dr. Adrian from Advanced Dental Artistry. I just want to go through the current technologies when it comes to dental implants, especially all-on-4 treatment. As you know, technology is moving very quickly, and the whole idea of using technology is to make it more comfortable for the patients, but also a much more predictable result. So the first is actually a 3D bone scan. 3D bone scans have been around for a long time in the medical field, but as dentists, we haven't been able to buy or have a machine in the practice, and this only changed in 2018. What a 3D bone scan is it allows us to see the bone not in 2 dimensions like on an X-ray, but in 3 dimensions, so we can actually virtually place all of the implants and know what size and shape and width of the implant to actually place. And what this does is it eliminates any sort of guesswork when it comes to placing the implants, and this is very important for not only the longevity of the implants, but also where the final bridge is going to go. The second technology that has come about is intraoral scanning, and intraoral scanning allows us to use this technology to take a copy of the patient's mouth, so a virtual copy of the patient's mouth, and this decreases the need or eliminates the need to take impressions. And we all know that patients actually hate having impressions taken because of course the putty has to go in the mouth and actually set. More importantly than this though is that it's very inaccurate. When we take impressions, there is some shrinkage or some expansion, then we have to pull models, and all of these steps basically create a lot of inaccuracies in the treatment. So by actually scanning the mouth directly is so much more comfortable for the patients, but so much more accurate. The third thing is facial scans. We all know from iPhones that we can actually use our face to unlock our phones, and this technology has actually been around for a long time, but now we can take 3D scans of the patient's face, and this allows us to place the teeth in the exact position that we want to before we do surgery, so it's much more predictable and we know exactly how the cosmetics are going to look before we do treatment. And the fourth thing is using a new system to scan for the implants during surgery, and this is called an iCam 4D. It's also there's another company called Pick Dental that also do something similar. And what it is instead of again taking impressions and molds and verifications during surgery, we can actually put little flags or little dominoes on the actual implants or abutments, and we can scan this. And what this allows us to do is actually get a precise idea of exactly where the implants actually are, so that we again don't have to take models or impressions when it comes during surgery. Again, this is to ensure that it's a lot more comfortable for the patients, but also that it's very precise and very accurate so that we know that the result is predictable.